Hello everyone, welcome to Council India Present Mental Health Talk Show. So, as you know that in this particular talk show, we talk about a particular topic, we discuss about something. And Council India has kept these discussions, these talk shows free of cost for you so that you can learn, so that you can improve, so that you can do better in your life. So today we have a topic named depression, which is really common. And there are a lot of people who use this word so frequently. And in today's world, definitely it is very important to have the remedies, have the solutions for the depression. So to have a discussion on this topic, I would like to welcome to our guest of the day. Her name is Ayushi Madan. She is a clinical psychologist working in this field from last 8 years. She has done a lot of work in hospitals, with NGOs, with schools, with clinics. So she's having a lot of experience. She's a clinical psychologist. So I welcome Ayushi Madan on Council India's platform and to discuss about this topic, depression. Welcome, Ayushi.
Hello, thank you so much for the introduction. And I'm really happy that I'm associated with Council India because you are doing a great job by spreading awareness about mental health in this field, which is actually the need of the hour. So I'm
Thank you
really
so much.
happy to be a part of it today.
Thank you. So let's move forward for the discussion for today, which is depression. Okay. So first of all, I would like to ask you, what depression? I mean, there are a lot of people who are talking about depression, and generally in common sense, oh, I was depressed at that day, right? So
Yes.
what depression is not?
Okay, so as you rightly said, that depression is used as a very common term these days.
Hmm.
Like any person who feels sad says, I'm depressed today, or I was depressed today. But people are actually interchangeably using it with sadness. When you are having a low mood, then people say that I'm depressed. So you are not depressed if you are only sad, because depression is actually a mental health disorder. The people in this world are not actually understanding the intensity and the severity of this term. It is a mood disorder which has a lot of symptoms, and low mood is only one symptom out of it. So if you are having just low mood because you are not having good day to day, or things are not going according to your choice in one day, so you can't say that I'm depressed. Having grief because of death of loved one is also not depression. Many people confuse grief also with depression, but depression is a mood disorder, and it can only be diagnosed when the set of symptoms are actually persisting for at least 2 weeks. This is the major criteria according to the ICD, which is the actual diagnostic manual that we all use, the mental health clinicians and practitioners. We use it to diagnose depression.
Okay. So sadness is one of the symptoms. Sadness
Yes,
is not depression.
yes. Even grief is not depression.
Grief is not depression. Grief means when somebody is having extreme pain after
Yes.
losing someone in their family and
Majorly,
their
it is the
friend.
emotional pain. Majorly, it is
Okay.
the emotional pain when you lose somebody. It can be a loss of pet, it can be a death of loved one, it
Hmm.
can be a loss of job, which
Hmm.
actually only majorly consists of loss of emotional pain, which is there. So that is the main grief, but it is
Hmm.
not similar to depression. Depression cannot happen in one day. It takes a lot of time. The symptoms take a lot of time to persist
Hmm.
in the person's personality and nature, and then it can be diagnosed as depression.
Yeah. And what are the other symptoms you will suggest for the depression? I mean,
There are many,
how? Yeah, please.
many like
Like,
reduced concentration, loss
mhm.
of appetite, sleep disturbance, loss of involvement in social activities. You are not engaging in the society, and lack of personal hygiene and care. The self care is actually absent, especially in the severe depression case. And loss of appetite is already there. loss of confidence, loss of self-esteem.
Hmm.
These are the major ones that are there. And
Okay.
also in the severe depression case, the suicidal thoughts persist. So the person becomes suicidal. The suicidal ideations are there.
Okay. So a lot of symptoms are there.
Yes.
And when these symptoms are persistent for a longer period of the time,
Yeah.
then only it may be depression, right? Not necessarily depression.
Majorly, if it is persisting for at least 2 weeks,
Hmm.
then we can say that it can be falling under the category of depression. But we can't just say that a person comes to
Hmm.
you and tell you 2, 3 symptoms of depression and you diagnose them with depression. It
Hmm.
takes a big deal. You actually have to go through a complete detailed case history. You
Hmm.
have to do the mental status examination.
Hmm.
And through the clinical interview, you get to know that yes, person is under depression. Because nowadays people are using this term very frequently, and that is actually called labeling. You can't label
Right.
a person with depression because it is a very big term. It is about you are diagnosing a person with a mood disorder. So that is the main problem with the current society which is going
Hmm.
on.
And you're also saying that it's okay sometimes we feel sad, it's okay sometimes we want to be get disengaged with the society, we want to spend some time with ourselves. It is okay, right?
Yes, completely okay. Actually, I always say to my clients, even to people around, that not every day is a good day, right? Even we say that if there is fluctuation going on, if there are good and bad days coming, if there
Right.
are bad days, then only you will appreciate the good ones. So it's completely okay to be sad. It's completely okay to feel low at times because that is all about life, how you cope up with it, right?
Right. So, okay, so you're saying it's okay to have some symptoms of low mood and other things, and
Yeah.
not necessarily it will be a depression,
Yeah.
but when to identify that it will be a problem, it will be a challenge, when we need to focus on it, and what is the point when we need to seek help, because in many cases we can be our own counselor as well, right? So when to become our own counselor and when to seek help from any of the counselor or psychologist, what is your idea?
Right. Actually, when we say a stress-free life, there is no that term stress-free life. We all face
Hmm.
stress. We all have negative thoughts that comes to our mind. Even we as clinical psychologists also have a lot of negative thoughts that we have to deal with in day-to-day life.
Right.
So in the beginning time, when you're facing negative thoughts, when you're actually having stress because of any societal issues or because of your work life problems or your personal problems, then there are many times when you will feel low mood, you will have negative thoughts, you will not feel like eating, your sleep will be disturbed. So
Hmm.
initially, people don't seek help immediately to the psychologist or to a psychiatrist. They
Right.
firstly try to handle it on their own end.
Hmm.
But when your work life gets disturbed
Hmm.
or when you reduce a lot of amount of weight, then it's a alarming state. So
Hmm.
generally it is said if you are losing more than 5 kg or
Mhm.
4 to 5 kg suddenly or in a very short span of time because of loss of appetite and because of stress, then it is also one of the red flags that you have to see. Secondly, when there is insomnia coming, like you
Hmm.
are not 1 or 2 days or 2, 3 days, if you're not able to sleep, then it is manageable. You can manage it on your own end by using the first aid things, the self
Mhm.
help techniques that we also teach to the
Hmm.
clients. But
Okay.
if that is also not helping you, then it is always good to consult and seek help from a psychologist. Yes, this is something which is in trend that people don't go immediately to a psychologist. They talk to their friends,
Hmm.
they talk to their well-wishers, they talk to their family. It is also good to some extent. अगर हम अपने आसपास के लोगों को देखें तो
Hmm.
generally we all do that. Even we
Right.
do that. Even if
Right.
I'll have a problem, I'll not go to the psychologist directly. I'll talk to my
Right.
mama, I'll talk to my
Hmm.
husband, I'll just talk to people around me. बट अगर ये आपकी सोसाइटी की आपकी वर्क लाइफ बैलेंस को डिस्टर्ब कर रहा है, इट इज एक्चुअली डिस्टर्बिंग योर पर्सनल सेल्फ केयर टाइम, it is actually disturbing your societal rules that you have to follow, then it is an alarming state. So your body actually starts giving alarm that it's a high time. You better talk to a therapist or to a psychiatrist. So that
Okay.
is very important.
Right. So initially हमें आई मीन सेल्फ हेल्प टेक्निक से काम किया जा सकता है, अगर एक दो दिन की बात है, 2-3 दिन की बात है, क्योंकि लो और हाई मूड्स सबके चलते रहते हैं लाइफ में। स्ट्रेस या बहुत ही डिफिकल्ट सिचुएशंस लोगों की लाइफ में आती हैं, राइट?
राइट।
तो अगर हम बात करें कि पहला हम बात करेंगे सेल्फ हेल्प टेक्निक्स के बारे में, दूसरा हम समझेंगे कि साइकोलॉजिस्ट कैसे हेल्प करते हैं, साइकोलॉजिस्ट का मेथड क्या है। तो सबसे पहले अगर मान लो हमने आइडेंटिफाई कर लिया कि ठीक है, ये जो सिम्टम्स हैं ये मुझे मेंटल इलनेस की तरफ ले जा रहे हैं, राइट, मुझे कुछ करने की जरूरत है, तो मैं क्या करूं, कैसे, वो सेल्फ हेल्प टेक्निक्स क्या है? या
there are few self-help techniques which is actually very important and we always use it while spreading the mental health awareness. First is to be expressive. It is very, very important that you talk it out. If you are not having any close person in your family, then talk to any well-wisher, talk to any friend, talk to any person जिस पर आप trust कर सकते हो, because that is very, very important. If you will keep it to yourself, the suppression actually makes the things more worse. So talking it out is very important aid that helps the people to feel a bit lighter, because that is what we also do in psychology, that when a patient comes to us, we just hear them out in the first few sessions. It is called as catharsis, where you let the person vent out whatever negative is there, and you just give them an ear to hear, so that they can just be comfortable and they can trust you that the information will not leak out. So first is being expressive.
right,
Second is doing things that makes you happy. I always called as sources of happiness. I always tell people to identify what are your sources of happiness, what makes you happy. Like for me, if I take for an instance, I love cooking. So
right,
cooking makes me happy. But maybe for some other person, it's a burden that you have to cook every day.
right,
So every person
Exactly.
has different sources of happiness. So you have to figure out what are your sources of happiness, what calms you down, and which is your happy place. Like I always say, happy place is something which actually gives you a peace of mind. It can be any mountain area, it can be any cafe, it can be going to a gurdwara, it can be any religious place where you just feel that you are on your own and there's nobody who can judge you. So finding your happy place, using your sources of happiness, they are the other ways as a self-help technique. Then there comes a writing down your thoughts that bothers you. It's
Right.
very important to make a diary. It is one thing which I always encourage and tell people, that when you write it down, it's just like that you have vented out the negativity. So writing those negative thoughts helps a lot. It's actually called as journaling. Journaling means when you are writing what's bothering you, so you're just making your head a bit lighter, ताकि वो जितना भी है दिमाग में भरा हुआ वो सब पेपर पे उतर जाए. And that is very important. So this is another way of self-help technique. And another is indulging in hobbies. Do things that makes you happy by indulging in keeping yourself busy. Nowadays, as we were talking about, that keeping yourself busy is very important.
Right.
If you're sitting idle, it is actually making your life meaningless. And when you don't have a purpose, then it is actually a very big problem. That's why these days geriatric depression is very common. I have worked in my thesis on geriatric depression, which is depression in the old age. And the main cause there in the old age of in depression is that you are not having anything to do.
There's no purpose. Right.
Yes, there's no purpose. Like for 60 years, you were engaged in some or the other thing. And then suddenly there's like everyone is busy and you are the one who is sitting idle. So you always lost the meaning of life. So keeping yourself busy is also one of the important self-help technique.
Right. So these are the techniques you are sharing. One is expressing your thoughts, your ideas, talking with somebody.
Yes.
Second is what makes you happy. Find out. Like
Right.
you said, cooking makes you happy. There are a lot of people who like to play
Hmm.
maybe video game or any
Right.
outdoor activity as well,
Right.
and they can go outside as well.
Hmm.
Traveling makes them happy, right?
Yes. Yes.
Writing their ideas, their thoughts on the paper, this will also make them feel light and be busy.
Hmm.
Keep doing something. Do not sit idle, because if you'll be sitting idle, because there are a lot of thoughts going on in the mind.
Yes. Even you
Yeah.
can add on one more, which
Hmm.
is like using your affirmations, positive
Hmm.
affirmations. Like you have written at the back also, I'm not here average, I'm here to be awesome. So
Right.
these using these kind of affirmations actually uplifts your mood and
Right.
gives you a good positive direction in life. So writing one positive day,
Hmm.
one positive sentence every day
Hmm.
actually gives you a kick start for the day. और ऐसे बोला भी जाता है आपका मूड
Hmm.
जैसा बिगनिंग में होता है व्हाट यू डू इन द अर्ली मॉर्निंग व्हेन यू गेट अप it actually gets carried away for the whole day. And
Hmm.
you can also see it yourself that आप सुबह सुबह किसी से लड़ाई कर लो
Hmm.
और उसका इम्पैक्ट पूरा दिन रहेगा, you will be irritated whole day. So
Right.
having a right state of mind, especially in the morning, is
Hmm.
very important. So if you are using affirmations, then it
Hmm.
actually helps.
राइट, तो मॉर्निंग में मेजरली आप क्या करते हैं, वो काफी मैटर करता है.
Yes, definitely.
ओके, आई हैव वन क्वेश्चन. ऐसा बहुत बार लोगों ने सुना है कि मेक योर डायरी, राइट डाउन, टॉक टू द पीपल, टॉक टू योर फ्रेंड.
Hmm.
ये टॉकिंग और राइटिंग, हाउ डज इट हेल्प एक्चुअली, व्हाट इज द मैकेनिज्म बिहाइंड इट? ये हेल्प करता कैसे है? क्योंकि कई बार क्या होता है कि हमें कुछ लॉजिक्स भी समझ नहीं आते, तो भी हम फॉलो नहीं करते बहुत सारी चीजों को. इवन
Right,
सेल्फ हेल्प टेक्निक्स को भी हम बहुत लाइटली ले लेते हैं कि इससे क्या ही होगा, मेरी
right,
प्रॉब्लम इससे बहुत बड़ी है, इस छोटी सी चीज से सॉल्व नहीं होने वाली.
right,
हाउ
right.
डज दिस वर्क?
So basically, when you say that you talk it out to people or you write things down, major problem with depression is that one of the symptom is feeling of loneliness. You feel that there's nobody around you who can hear you. You are all alone with your problem. And there is a big term that comes, why me? Why I'm the one who is suffering, why
राइट.
I have faced breakup, why she cheated on me, why this happened, why that happened. So there are a lot of whys there,
राइट.
right? And when you are having some symptoms of depression, every person becomes pessimistic. They cannot see the picture from another angle. So
राइट.
when you vent it out to somebody who is actually not in depression, who is having the right mental state, they give you another angle to see the picture. That see, if the person cheated on you, it means he was not loyal. He doesn't deserve to be with you. So see it from another angle, what goodness this has brought in your life. Now, how things can be better in your life. So first is this way that you don't feel that much lonely when you vent it out.
राइट.
Okay. Secondly, you always feel that, okay, there is some moral support, there is somebody at my back. So I can actually have somebody to whom I can share and I can say anything without judgment. They won't judge us for this. Okay. Then, when you are saying about self help techniques, suppose I'm writing something very positive that today will be a beautiful day, or today is an awesome day, it's a great start. So these things always instill a hope. It inculcates hope in us. And also, as I have also done some courses on graphotherapy. So graphotherapy says that whatever you write down, your mind is actually a blank slate. So whatever you write down in the morning, it actually gets imprinted on your mind. So writing always helps. Maybe that's why when we are in school, we are always encouraged by teachers to write and learn. लिख
राइट.
कर याद करो,
लिख के याद
बहुत
करो.
कॉमन बोला जाता है. क्यों? क्योंकि whenever you write it down, it always has a better impact. So writing the affirmations always keeps you going. It actually makes you hopeful that no, I can't lose hope. There is still something positive. And that's the whole trick with the self-help techniques, that out of whole mess, when you're able to find out something positive, then there are less chances that you can go under depression.
बट एक चैलेंज इसमें आता है उन लोगों को सेल्फ हेल्प टेक्निक्स को अप्लाई करने में, because their mind is negative at that time. Negative thoughts, lot of negative thoughts are coming up in the mind.
Right.
When they start using affirmation or trying to write down one positive thought, like today will be the good day, right? Then again, next question come, how? Not possible. Everything is messed up in my life, so it is not possible. Second thought is coming up कि ऐसा नहीं होने वाला है. So ये thought create करके वो अपना जो positive thought का impact है, they are diminishing it, right?
Right.
So how to make a change of the positive thought then?
Actually, when you are having just mild symptoms of depression, then these challenges doesn't come up. Because when you are writing positive or you are sharing it with somebody, even if not in family, then outside, like with your friends or any near dear ones, then these problems generally don't come up as a challenge. The challenge comes up only when you are not able to be physically active and you can't put the words into action. I am writing today will be a good day, but I'm not doing anything for it. So no, nothing will change. It will be a bad day only. So making a change along with writing is important. But if you will be under depression, then definitely it will be advised you to go and seek help from a counselor, a person who is actually trained to help people like you.
Right.
So when you're not able to do things and when you're not able to feel any difference, even after using self-help techniques, it is always suggested to seek help. Go to a trained professional who can actually guide you what to do and what not to do.
Right. Got it. So in that case, when self-help techniques are not working, your writing of thoughts is not working, then seek help, then go to a professional.
Yes.
Perfect. So that's how we got to know about self-help techniques. Now we want to know, like when a person is going to a psychologist, right? First thing, is it a challenge? Like, because in the society it is a taboo, like somebody is going for a counseling session to seek mental health help. It is a taboo in the society. It is negative. It is having a negative image, though it is improving now.
Right.
But still, how it work? Like when a person is going to a psychologist, so what will happen there?
See, you rightly said that nowadays also it's a challenge because people are actually using it as a taboo or a label, even though now the awareness is much more than what it was 10 years back.
Right.
But still, when people say ki, okay, you go to a psychologist, they have an answer, "Arey main pagal hu kya?" They have this line, "I'm not mad.
Right.
Why you are referring me to a psychologist or a therapist?" But
Hmm.
actually, when you actually go to a psychologist, it helps a lot. How?
Hmm.
Now, a psychologist is one person who is actually trained to be non-judgmental. So you know that whatever you will share, even if you will share the worst things of your life,
Hmm.
the person will not judge you. They will
Hmm.
still be your well-wishers. They will still be a team to you. And
Hmm.
you and the therapist together can work as a team to bring you out of this. Secondly, any person who is not trained, they will not be having a training about how to dig deeper and figure out the root causes of depression. Because causes can be many things. It can be the family history of depression. It can be any abuse, be it of physical, sexual, or emotional abuse in childhood, because it makes you more vulnerable in adult life. Right. Then it can be age factor. It can be the workplace environment or any day-to-day challenges which has led up to this situation. So when you go to a psychologist, they dig deeper and they figure out the root cause of depression. So that's how the relapse cases are very less in depression. If you actually treat it and you take the proper course and treatment of depression. Secondly, there are a lot of therapeutic procedures which are used, like cognitive behavior therapy, schema focused therapy, and behavior therapy. So we generally prefer a combination of different therapies.
Right.
And because every case of depression is different, two individuals, they are two unique people. So we
Right.
cannot use the same treatment for every depressed case. So
Right.
we always customize the therapeutic treatment based on the personality, based on the needs of the person, and then accordingly we make a whole treatment plan for them. And along with that, this is not something which is done, which can be done by a layman person. A person who has not got training cannot make a treatment plan, cannot
Right.
dig deeper and find out the causes, and they cannot provide those therapeutic techniques which we actually get training in our MPhil, right?
Right.
So there is a huge difference. You are just consoling a person, no, don't worry, I'm there with you, or you are giving some suggestions. It is totally different from using therapeutic techniques and
Right.
treating the disorder from the root cause.
Right. So if anybody will be going to a psychologist, they will be using a scientific approach to solve the problem.
Yes.
Right. They'll be using therapies. They'll be going deeper to the problem, understanding the root cause of the problem, and then working on it with the different therapies.
Yes. Yes.
Right. So there's a perception about therapies as well. Like in therapies, how these therapies work actually.
So
Simple language.
therapy is, matlab said, if I say about therapy, therapy is about talking. It has, but it's not only about talking, conversation, using a treatment plan which has therapeutic techniques. Like if in depression, we use a thought diary where we give them a proper format for it, where they have to note down the negative thoughts. Then they have to replace the automatic negative thoughts with the positive thoughts. So it's like when you work on the core negative beliefs, because in depression they have a lot of negative belief system about themselves, about others, and about the whole world. They don't think bad about only themselves, but they blame others also for their situations.
Right.
So there is a whole negative setup which is actually changed and replaced with a healthy core schemas. They are also changed with healthy positive mindset and statements which are used. And along with that, it is important to make a person physically active. So a proper activity schedule is given to a depressed person, because the first challenge that comes up with a depressed patient is they are not physically active. Even if you tell them go for a walk for half an hour, getting them out of their home is a big challenge. So
Right.
a psychologist can't work alone. It's a teamwork, because family support is very important. So
Right.
when a person comes to us and we get to know that yes, after the clinical interview, the person is in depression, we talk to the family, we psychoeducate them that your person needs help and
Right.
we can't do it without your help. So family support is taken. In some cases, when the person is very close to friends, then the help of their friends is also taken. And along with them, it's a proper teamwork that goes on, where we coordinate and take regular sessions initially, and we see their improvement. So we work up as a baseline.
Right.
हम उनको एक timeline देते हैं, where we see, okay, the workplace is affected, आपका personal life is affected, your relationships is affected. So we assess all the areas. We do some assessments also on depression to see the severity of depression, because there are 3 areas: mild, moderate, and severe. There are
Right.
3 categories of depression. We
Right.
see what is the intensity, and accordingly we customize the plan so that we can have some therapeutic techniques which are fit into their daily routine. And they are very casual therapeutic techniques which they can do not as a burden, but they can enjoy it. So some written work is there, some music therapy is there, some kind of relaxation exercises are there. So it's a combination which is used to bring them out of the depression state.
Right. Right. And I also want to know, there are a lot of people when something bad happened in their life, especially these mood swings or the depressive symptoms and other things. So instead of going to a psychologist or the counselor, they go to the life coaches, they go to the astrologers, right? They go to the tarot card readers,
Yes.
right? So
Yes.
when they should go to those people, not to psychologists, and how the treatment, how the plan, how the conversation is
Hmm.
different. Now we got to know how psychologists are working. You have already told about it, and but
Right.
how it is different from those, like what they do actually.
So, see, when you're talking about life coach, as we
Hmm.
know, depression and be it any other psychological disorder, it actually impairs your life. It
Hmm.
actually disturbs your life routine, your daily routine, your involvement in the society, your personal self care activities, your work life balance, everything gets disturbed. So, a life coach actually works on what all areas are affected in the life, and they focus mainly on the routine part, that okay, what is an ideal way of dealing with life, how to cope up with life, how to cope up with stress in your day-to-day life. So their focus is more on the daily life routine rather than using therapeutic techniques.
Right.
But if it comes to astrologers and tarot card readers, generally people go there because with depression anxiety comes hand on hand. They become too much fearful that what will happen next because they're already pessimistic.
Right.
So there is a attached fear and stigma that something wrong is going to happen. So with the help of tarot card readers and astrologers, they always ask about future. They will never
Right.
ask about the past because they're already aware of it. हमें
Right.
पता है पास्ट में क्या हुआ है, हमें ये
Hmm.
जानना है कि आगे क्या होने वाला है.
Hmm.
So they talk more about their fears. They want to know what is coming up next.
Hmm.
So when depression goes hand in hand with anxiety, the chances of going to a tarot card reader or astrologers, the probability increases. But they can predict, they can always give you idea about what is coming up. But obviously that has no 100% accuracy. But
Right.
when you are actually going to a psychologist, they are working on the treatment part, not only reducing your anxiety by telling you what is coming up next. They actually figure out the root causes of depression, and they actually work on the baseline for it. Right?
Okay. Hmm.
Yes.
Right. So that's how it is different, right?
Yes.
So
Yes.
person should approach to a psychologist because they can provide you the technical and the holistic approach to the solution
Right.
and the scientific approach to the solution. This is really nice. So we are moving forward to end of this session. So I have few words for you. So whatever you understand at first place about these words, so you can let me know about. You can give the answer in one word as well, in one sentence as well, right? So it's kind of rapid fire round of the
Oh,
questions. Okay.
okay. Okay.
Perfect. So what comes up in your mind by education?
Awareness,
Awareness. Great. Technology.
smartness,
Smartness. Human.
loved,
Great. Meditation.
mindfulness.
Great. Marriage.
A huge step in life, an important one as well. Being a married girl, I can say this.
Okay. Advice.
Stay always positive in your life because everything comes up when you're having a positive mindset. If you are making the first move, everything will fall in the right place.
Right. Great. Well, thank you so much. It was really a lovely conversation with you. And of course, we got to know a lot about mental health, about depression, especially, and how psychologists approach the depression problem. And of course, we love those self help techniques where people can help themselves. They do not need to go to the psychologist. But the major remember is this: when the self help techniques are not working, seek help, go to the professional counselor or the psychologist, right? And I also thank you for joining Counsel India and doing a great contribution in terms of taking sessions, taking training sessions for the people who really want to learn psychology. And thank you so much for your contribution. I also want, yeah, thank you.
Actually, I want to say a personal thank you to the Council India team because you're doing a great job. Because right now it is very important to spread awareness about mental health and encouraging people to understand what is psychology is all about. Because people are sometimes hesitant to talk about these things, especially depression, and which is very common worldwide. I was reading this that right now in 2022, 56 crore people are actually the identified cases in India of depression. And it is a
56
huge
crore.
number. And these are those ones which were reported.
Right.
So we can actually understand what is the intensity right now. And it is actually the need of the hour to encourage people to come out and speak about these things openly because it is as common as fever these days.
Right.
So when you can talk about other things, you can talk about your mental health also. So I'm
Right.
really happy to get associated with Council India and looking forward for more sessions ahead.
Thank you so much. And I also want to tell people that if you want to learn counseling skills, if you want to learn more about psychology, if you want to learn how psychology is working, if you want to help people, if you want to help yourself, so come to our platform, learn psychology, improve your life, get better quality of life, and help your family, your friends, and the people around them. Thank you so much. Thank you, ma'am.
Thank